Welcome back. Let's turn our attention to other news making headlines. Cabinet has assured South Africans that government through the Department of Health is closely monitoring the emergence of a new COVID-19 variant. It's known as Nimbus or NB 1.8.1. According to the Health Minister, Dr. Armutsaledi, South Africa has robust surveillance systems that's managed by the NICD, the National Institute for Communicable Diseases, where the Department of Health, it also continues to urge the public not to panic regarding this new variant. But perhaps for more on this, let's be joined by National Department of Health spokesperson Foster Mohale. Foster, very good afternoon and thank you for your time. Pertinent matters that need to be addressed here. And so I think before we delve into this discussion, perhaps you could just clarify, whether COVID-19 is still lurking around. People who really don't understand what's coming to the fore, how bad the scenario is in terms of protocol. Does one wear masks? Perhaps you could ease those concerns at this point. Put us at ease and explain what is transpiring. What are the do's and don'ts?
Definitely. Good afternoon to you and good afternoon to your viewers at home, and thanks for this opportunity. We can confirm that COVID-19 has never been eradicated. It was just declared that by the World Health Organization, I think years ago, that it was no longer public health emergency of international concern. So COVID is with us. That's why we always encourage people to say those preventative methods that we used to preach during the peak of COVID-19, they are still applicable even now. So we can prevent not only COVID-19, but other respiratory diseases like flu. As you know that during winter season in South Africa, it's also a flu season. So we can prevent further spread of COVID-19, flu, and other respiratory diseases if we maintain those protocols, which include maintaining personal hygiene at all times, meaning washing our hands with water and soap or using the sanitizer. We say avoiding close contact with anyone who is sick, who displays symptoms which are similar to COVID-19 or flu, symptoms like your headache, your fatigue, your body pains, your cough, your sore throat, and fever. But also in terms of face masks, this must be not a mandate currently in the country and other parts of the world to wear a mask when you go to public spaces. But for those who go to crowded spaces where they feel uncomfortable, they can safely wear the mask just to protect themselves against the infection.
Okay, you're obviously still monitoring the situation rather closely, and obviously as questions about Nimbus now take center stage, you're saying that it's not a national health crisis. There are protocols, but I wonder if we look at the pandemic agreement perhaps reached with other countries, what's been put in place on that front? I'm asking this because we're seeing COVID cases in other countries such as Asia, rising, and so obviously trying to not panic and raise too much of the alarm there. But talk to us about those agreements, just to ensure that people are best protected, but particularly if travel is involved.
No, definitely. You remember during the peak of COVID-19 years ago, countries for low to middle income countries like in Africa, they struggled to access life-saving vaccines, while those countries around Europe and other parts of the world were doing what we call vaccine holding. So this pandemic agreement is going to ensure equitable access to life-saving vaccines and other necessary measures to ensure that no country in the world is going to be left behind as far as accessing COVID-19 vaccine, in order to ensure that we are trying to protect all other countries. We want to, the priority or the objective of agreements to ensure that we don't experience what we experienced during the peak of COVID-19, and in terms of future pandemics, not only applicable to COVID-19, but any other future pandemics, Ebola, and so forth.
All right, and thank you for speaking to that, because prevention is always better than cure. So if we're looking at some of those measures, even just the testing, contact tracing as well, to get, that accurate picture, talk to us a little bit more about how that is also going to be unfolding with regards to this particular variant.
Yeah, no, this variant is not different from the other variants, especially under Omicron. In terms of that, we always preach prevention is better than cure. So if people they heed our call when we say practice a non-pharmaceutical intervention, we can save the country a lot in terms of spending millions of money on vaccines. But also we can disrupt the spread of this life-threatening health conditions such as COVID-19. So when we say people try to maintain personal hygiene at all times, we say hit our call when you are cough, which means especially when you are in a crowded space, try to cover your cough or your sneeze with elbow, please. That's the way we can be able to cost effectively prevent the spread or the transmission of this to our loved ones and other people that we live with.
Okay, for clarity's sake, if we're comparing this variant to Omicron, perhaps also Delta, what's the distinguisher there? Even in terms of signs and symptoms, what should the public be looking out for?
In terms of this variant is what we call it the descendant of Omicron. In simple language, it's the subvariant of Omicron. In terms of symptoms, the symptoms are exactly the same symptoms of other variants, and also the same symptoms of flu, which is currently circulating in the country. So, hence we say the same vaccine that we use to vaccinate people is still remain relevant, and also is going to protect us against this variant for now, because in public health we say variants, they mutate. Mutation means if it's less severe, less transmissible now, at any time it can change and become more severe, more transmissible. But based on the current data now, the current variant number is less severe, less transmissible. That's why even in the countries where it's currently spreading, there are less reports or cases of hospitalizations and death. But that doesn't mean we must lower our guard.
Because, Mr. Mohale, we're looking at what's on offer in terms of treatment as well. I wonder if the current vaccines still stand against this new variant. Are there booster shots available in winter season? What should we be looking out for on that front? What can you confirm in relation to that?
Yeah, in terms of vaccine, currently we don't have a stock of vaccines, but based on the agreements, including pandemic agreements and other agreements that we signed with other countries, this time we will be able to quickly access vaccine if this variant mutates to become more severe, more transmissible. But we say for our viewers and South Africans, we should not only rely on vaccines, but we can prevent further spread of this through our behavior, through the way we conduct ourselves, in terms of coping, in terms of wearing the mask, in terms of maintaining hygiene. These are cost-effective preventative methods. Of course, vaccine is still relevant when the situation becomes worse.
All right, because there's obviously also a role that the media plays in striking that balance between informing, but also not, creating too much of an alarm and causing public panic there. And so thank you for clarifying all these necessary issues. I wonder, even if we're looking at the healthcare system at large and the impact this is also going to have on healthcare workers, just in terms of how they are better prepared, vis-a-vis what transpired with some of the other variants, even during the height of the COVID pandemic, PPE as well coming to the fore. What's being communicated on that front? How have they been better equipped in terms of healthcare?
Yes, we've learned lessons from the previous outbreak, and we're building from the lessons that we've learned from the previous. So in terms of our preparedness, we developed what we call pandemic response and preparedness plans as a country, as government, working closely with non-governmental organizations, in terms of our health system, we strongly believe that this time our health system is ready to respond to any pandemic of whether it's COVID-19 or influenza or Ebola.
All right. And just as we wrap up, obviously we're in an era of misinformation and disinformation. And so as the health department, government at large, what are you doing to ensure that the messaging is tight and that does not spread at this point as we conclude?
Misinformation or fake news, we consider it as another pandemic in the country because that has been spreading and confusing people, creating unnecessary things. So our message to South Africans and to the viewers of SABC, we say, please, when you come across suspicious information which creates unnecessary things, please verify that information with the nearest Department of Health. Either you can go to our website, you can go to our social media before you act, and also want to discourage people from forwarding any form of message that they don't understand, because that also contributes to unnecessary payments. So we say our platform, our offices, they provide most reliable and up-to-date information as far as pandemic is concerned.
National Health Department of Health spokesperson Foster Mohale, they're just weighing in on some of the dynamics unfolding in relation to the new COVID variant Nimbus that has been reported, closely monitoring those developments there as it unfolds. Thank you again to Foster for allaying some of the fears and concerns surrounding that, and really what some of the do's and don'ts are also in relation to that as more data becomes available.